Dimapur de dengue laga bimar bharigina jai thaka upar District Hospital Dimapur laga Chief Medical Officer Dr. Limatula Aier ba kushiki dengue bimar do ekta epidemic na hoy holebi 2022 साल दे compare kurishe kule itu साल दे dengue bimar record kura do bishi ase CMO bra janashi ki dengue bimar detect kuribule department ba rapid antigen test kuri ase dengue nishna symptoms thaka bimari khan do RTT test kuri ase aro positive case confirm kuribule samples kan pathai ase CMO bra janashi ki test kura samples pidore 14 to 20% nishna positive dengue case record kurishi aro janda khan ki binti kurishi ki dengue laga symptoms thakishe kuile juldi hospital jaigina test kuribule to aibi dengue laga upar CMO bra jankari dia sai sabo.
First and foremost, I think the dengue being an epidemic was not announced by our department. We have definitely not said it's epidemic. And so that's one thing I would like to clarify and once again re-emphasize that dengue is not epidemic. There's been a surge in the cases of dengue, yes, this year as compared to last year. And so dengue cases are there, it's more than last year. But as of now, for dengue, there's a rapid antigen test, like COVID times, the rapid antigen test, and after that we have to confirm it through ELISA to make sure that it is a dengue case, because there are incidents of false positives. And so likewise, all the cases with dengue-like symptoms are being tested through RDT, and once that is done, then after that we are sending the samples for confirmatory tests. So out of that, the confirmatory tests, out of those that have been sent, the samples that have been sent, it's around between 14 to 20% of the cases are dengue positive. And so the deaths, like you were mentioning, the deaths that have happened are not on that line list. And so that way we cannot label it as a dengue death because their tests have not been, they're not confirmed as dengue. Now, there is the enterovirus that is going on. I think it started off with conjunctivitis also. We had sent it for serotyping and it had come out as enterovirus. So these are all the symptoms that come, they're all very dengue-like, those who are suffering. It's a viral infection. And so likewise, there's dengue is getting a bad name because of this, because of the similarity in the symptoms that patients are coming with. And so likewise, we have to be able to be we have to distinguish between that. Now, where blood is concerned, usually for platelets, dengue patients usually within after the 4th to 5th day, even though they're not, the fever is gone, many see a drop in the platelet count. And so we monitor this platelet count on a daily basis to make sure that it does not go beyond the critical level. So if a person is healthy and fit, eating well, keeping themselves well hydrated, then we don't expect it to drop below the critical level. They can manage, even if it's going down 20,000 also it's okay, 15,000 also is okay. We just observe to make sure that the patient, if there's no bleeding tendency and the patient is eating well, then usually we just observe. We don't ask for blood. But then now dengue has this panic thing. If it's going down below 20 or 40, even 50,000, they're looking for blood. Relatives are coming forward to donate for blood donation. And so this is one thing that we would also like the public to know, that we should not panic so much. I think it's okay, we've got it under control. But then when it is needed, then definitely they will be informed about the need for for platelets. We do not use stored blood. That is one thing we have to know. We don't use stored blood. We need fresh blood from where we can extract the platelets. And so that is why I think shortage of blood, as you're mentioning, is there in the blood bank. We need fresh blood. And so that is where people think the blood bank has got no blood and all that. But for others, where platelets are not concerned, the blood is there, but then for platelets too, usually we need fresh blood. So it will depend on the patient and on the donors that are there. And so I think we have to be very clear on that part. One patient may require more platelets than another patient, depending on the comorbidity that the patient is presenting with. or the patient maybe is having some sort of bleeding for which we may require more. And so age and comorbid conditions, and then the condition of the patient. According to that, some patients require maybe 5, 6, some may require on 10 or maybe even more. Dengue response team of Dimapur has also been formed. And so likewise, that's also including all the private hospitals. And so along with that, any case that they find positive, they're sending us the sample to the district hospital to run their ELISA. Well, there is certain protocols, and we do, where there is need, then they will have to let us know that we can't collect it. But then as of now, no one has asked us to come and collect. From the other, say from the other blocks or from the other districts, we are doing the needful where they say that we have got the samples collected. If we can send somebody to collect it, then we have got everything ready. So likewise, that communication is open. If anyone is not well, they need to come to the hospital earlier than later. Bishi deri para ha bishi ase. None. So if they can get themselves treated early, tested early, then that way we can intervene earlier, and likewise steps can be taken. This all comes down to the mass movement. Public should also participate in this. This is what we want, the participation of each individual in making sure that the breeding area spots for the mosquitoes is eliminated. And so if we can do the source reduction in our own homes and in our compounds, then I think dengue will be well under control as well. And so likewise, we have been showing them where the spots are, where to look for the mosquitoes, where they breed, the breeding places within the house itself. Say many of times we don't look at our fridge water drip tray of the fridge. We're finding a lot of mosquitoes breeding there in the respective houses. We have flower pots, we've got the tray there, we're finding a lot of larvae there as well. Now fogging is going to get rid of only the adult mosquitoes, but not the larvae. So this is one thing I think we all need to know. So if we clean out our house, within our house, then we're killing out the larvae, so next generation does not come up. Dengue mosquitoes, they bite not just once, but several times during the day. So, and then a dengue mosquito will lay dengue eggs. So this is the thing, the peculiarity of this dengue virus. And so it's got this ovarian, the transmission is there. So a dengue mosquito, adult mosquito, female mosquito will lay dengue infected eggs. And so likewise, the larva that is coming out does not need to be infected by anyone. They're already infected by the. So this is where source reduction is very, very important. And so this is what we are trying to advocate to everyone, that if we can do that in our own homes, then I think we'll be okay.